Hi, this is Jerry Hesch, and I'm teaching a workshop in Virginia City, Virginia on the lumbopelvic hip complex. And Sertina, you volunteered, you said that you thought that you might have this pattern that we name posterior glide of the sacrum, in which it acts as though the sacrum moves posteriorly and wedges the whole pelvis, and there's a loss of all accessory motions in the pelvis, creates a reflex hyperextension in the mid-thoracic and in the OA junction. What made you think that you had this pattern?
I've always noticed that whenever I lay down, mainly on firm to hard surfaces, I feel like my coccyx or my tailbone is like pressing against the surface. I've always had a white space underneath my lumbar portion. My thoracic rib cage always flares. Always thought it was this big, in quotation. And I've always felt tight in my sacrum area. Just always. Always been that way.
And how about in the upper neck?
Yes, sometimes I do feel tightness in my scalenes and upper trap, but I just say, okay, well then that's maybe just due to the daily living or just my activity studying. Yeah, so I never really took it seriously.
How's your energy level?
Oh, I get very tired.
What time do you get tired?
Lunchtime and at the end of the day.
Okay. What about on a Saturday or Sunday?
Not really. Sundays for sure. I do get tired.
Okay.
Same lunchtime and...
Any idea why?
I don't know. No.
Okay. I will demonstrate that there's not much mobility. And if I try to go inferiorly, no mobility there. If we do a lateral glide, no motion there. Can I have you lie on your stomach?
Oh, and another thing. When I sleep at night, I always do this.
Yep.
Or this.
Yep.
Or this.
Yep, I was going to predict that one. Very good. Okay, so it looks like your sacrum is prominent, but if I try and move it, nothing happens. And I'm isolating the PSIS, I'm above top of the sacrum, nothing. L5, no. L4, yes. Okay, as I go up the body, when I get to about T4 area, there's no motion there. If I come over to the ribs, no motion there, but you start to move a little bit below that. If I try and glide the sacrum inferiorly, nothing. Try and push hemipelvis up, nope. Feels like a block of granite here. And we already looked at your upper cervical, did we? And we did find restrictions there. So this is a pattern that we name posterior glide of the sacrum based on the appearance and based on the lack of spring tests. Is this a neurophysiological pattern that has nothing to do with the joint actually moving, but everything is so tight that nothing moves? I don't know the answer, okay? I do know that I actually climb onto the sacrum. Instead of a sacral sulcus, I actually come up from the PSIS up and onto the sacrum. So whatever it is, we quite oftentimes can treat this and gain mobility. So we are going to treat you, and we have one more person here who's a client that we're going to treat. So I would like to demonstrate on Diana the same pattern, and we'll just film her body without her face in the video. So Diana, you want to come back? Good. So you can step down, and I want you to go lay with the foam placed vertically, two of them, one on each side, for 5 minutes.